Stop everything! Texas is facing a measles outbreak, and it's spreading faster than wildfire. But here's the kicker. Lack of health insurance is playing a huge role in this crisis. How does this happen, and what can be done to stop it? Let's break it down and uncover the truth behind this outbreak. Let's go! Glaring issue fueling the flames: lack of health insurance. The state's high uninsured rate is not just a statistic, it's a major factor contributing to the spread of preventable diseases like measles. Let's break it all down. The health insurance gap. Why so many Texans are uninsured. Texas has the highest uninsured rate in the U.S., with 16% of adults under 65 and 11% of children lacking health insurance. That's over 5 million Texans without coverage, and the consequences are devastating. Here's why the uninsured rate is so high. No Medicaid expansion. Texas has chosen not to expand Medicaid under the Affordable Care Act, ACA, leaving millions of low-income residents without affordable health care options. High costs of insurance. Private health insurance can be prohibitively expensive, especially for workers in part-time jobs or small businesses. Many Texans are forced to forego coverage altogether. Healthcare deserts. Rural areas in Texas often lack adequate healthcare facilities, making access even harder for uninsured residents. Medicaid unwinding. Recent changes, like the expiration of pandemic-era Medicaid protections, have resulted in millions losing coverage, many of whom were disenrolled due to paperwork errors or lack of follow-up. The numbers paint a clear picture, but the human cost is even more significant. How the lack of health insurance fuels the measles outbreak. Lack of health insurance is more than an inconvenience. It's a breeding ground for outbreaks like the current measles crisis. Here's how. Missed vaccinations. Routine vaccinations, including the MMR vaccine that protects against measles, are often skipped because uninsured families can't afford the out-of-pocket costs. Delayed diagnosis. Without insurance, people are less likely to visit a doctor when they feel sick. This delays diagnosis and gives the virus more time to spread. No preventive care. Uninsured individuals often avoid routine checkups, meaning fewer opportunities for healthcare providers to educate patients about the importance of vaccinations. The result? Communities with lower vaccination rates are hit the hardest, and the virus spreads quickly in areas where access to health care is limited. Why this matters now. The Texas measles outbreak is a sobering reminder that healthcare access is a public health issue. Measles is one of the most contagious diseases out there. It can spread to 90% of unvaccinated people exposed to it. While vaccination is the most effective defense, lack of insurance leaves too many Texans unprotected. This outbreak isn't just a healthcare crisis, it's a systemic failure. The bigger picture, transforming Texas' approach to healthcare. The Texas measles outbreak is not just a temporary health crisis. It's a glaring sign of deeper systemic issues that need immediate attention. Addressing the lack of health insurance goes beyond preventing measles. It's about creating a healthcare system that supports every Texan. Let's break down the key areas for transformative change and why they're crucial. 1. Expanding Medicaid, a lifeline for millions. Texas' decision not to expand Medicaid under the Affordable Care Act, ACA, has left millions of low-income residents without affordable health care options. Expanding Medicaid could provide coverage to an estimated 1.1 million Texans who currently fall into the coverage gap, earning too much to qualify for Medicaid but too little to afford private insurance. Bring in billions of federal dollars to strengthen Texas healthcare infrastructure. Increase access to preventive care, including vaccinations, reducing the risk of outbreaks like measles. By expanding Medicaid, Texas can ensure that vulnerable populations, especially children, are protected and cared for. 2. Investing in rural healthcare infrastructure. Over half of Texas counties lack adequate access to primary care facilities, creating healthcare deserts that leave residents in rural areas struggling to get even the most basic services. Here's how Texas can tackle this. Build more clinics and healthcare centers in underserved areas, ensuring people don't have to travel for hours to see a doctor. Invest in telemedicine programs that allow residents to consult with healthcare providers remotely, making care more accessible. Support rural healthcare professionals with loan forgiveness programs and incentives to work in high-need areas. Closing the gap in rural healthcare access is critical to reaching uninsured populations and stopping preventable diseases before they spread. 3. Providing free vaccination programs. Vaccinations are one of the most effective tools in public health, but many uninsured families struggle to access them. Texas can step up by offering free vaccination clinics at schools, community centers, and places of worship to make it easy and convenient for families to get vaccinated. Launching mobile vaccination units to reach remote and underserved communities. Partnering with local organizations to educate residents about vaccine safety and benefits. Free vaccination programs ensure that everyone, regardless of their insurance status, has access to life-saving immunizations. 4. Expanding affordable insurance options. For Texans who don't qualify for Medicaid, the high cost of private insurance remains a barrier to coverage. Texas can create state-level programs to subsidize insurance premiums for working families, making coverage more accessible. This includes sliding scale subsidies based on income levels, reducing the financial burden for middle and low-income families. State-sponsored insurance plans offering affordable coverage tailored to Texan needs. Making insurance more affordable is a long-term investment in public health and economic stability. 5. Public health education and outreach. Education is key to fighting preventable diseases and closing the insurance gap. Texas can implement community awareness campaigns focused on the importance of vaccinations and where to access free or low-cost health care. Enrollment assistance programs, helping eligible families enroll in Medicaid, CHIP, or subsidized insurance plans. Health literacy programs, teaching residents how to navigate the healthcare system and understand their options. Empowering Texans with knowledge ensures they can make informed decisions about their health. 6. Tackling systemic inequities. Minority communities, particularly Hispanic and African American populations, are disproportionately affected by lack of insurance. Addressing systemic inequities means investing in culturally competent healthcare services that meet the needs of diverse communities. Ensuring language barriers aren't an obstacle by offering bilingual healthcare services and resources. Promoting equity in healthcare policy decisions to close the coverage gaps that disproportionately affect minority groups. The ripple effect of change. By addressing these systemic issues, Texas can build a healthcare system that doesn't just respond to crises like the measles outbreak, but prevents them altogether. Improved insurance coverage and access to care would lead to higher vaccination rates, reducing the risk of outbreaks, better overall health outcomes for Texans, decreasing emergency room visits and healthcare costs. Stronger communities where every resident has the tools they need to lead a healthy, fulfilling life. A call to action. The Texas measles outbreak isn't just a warning, it's an opportunity to act. By expanding Medicaid, investing in rural health care, and ensuring affordable insurance and vaccinations for all, Texas can turn this crisis into a turning point. Let's build a system where every Texan is protected no matter their income, location, or background.